That was a mouthful. But over to you, Matt.
Yeah, thanks. So my deep background is as a musician. I was a recording and touring artist for the last 20 years or so, and I have a special interest in long form instrumental music, which I think really, set me up in a way to support psychedelic experiences, especially the musical aspect of them. I've also been practicing as a psychotherapist for the past 11 years, specializing in ketamine-assisted psychotherapy for more like the past 5, and have done some work running a clinic and supporting clients in private practice, and have seen the sort of the amazing power of it, experienced it myself as well. So I'm a real believer in this, and I'm just excited to be a part of the team. Yeah.
Thank you for sharing.
Thanks, Matt. Thanks everyone for joining. It's a real pleasure to have our first webinar, first of many. As some of you know, I'm planning private practice in Los Angeles. This is a project that's been brewing for a number of years and finally coming to fruition. We have a really wonderful team that's coming together, and I'm really excited about what we have to offer. The vision with Mystic Health is have a holistic offering. It's a holistic approach to care that involves healing. And there's a distinction between healing and curing. Healing is something that can take place independently of the curing process. And that doesn't mean that we're not for curing, but in the cases where that's not possible, we can still offer healing. As you may know, I have a specialty in palliative care, and palliative care is a specialty that was sort of based on hospice care, and hospice care is end-of-life care. Palliative care was coined at McGill University, where I have trained and I teach. And the idea with palliative care is that it's a multidisciplinary approach to care. It focuses on patients and families when they are dealing with a life-threatening illness. And so, the idea is, let's say, a biopsychosocial and spiritual model where we try to address needs, in these various spheres of wellness. And so, what we have been doing, especially in Canada, we've been fortunate to use the Special Access Program and get approval by Health Canada to use psilocybin and MDMA for patients with severe and refractory illnesses. And so in the context of patients that are dealing with cancer or other life-threatening illnesses, we've been getting access to psilocybin. And for patients with a history of PTSD, we've been able to use MDMA, which many may know as a powerful tool in the treatment of trauma. And unfortunately, the recent events with MAPS and Lykos and the FDA have pushed back the official approval of MDMA, but here in Canada, we're still fortunate to use it. As we launch this practice in Los Angeles, our goal is more focused around ketamine. What's important to note is that we are not just a ketamine practice, but we are a practice that uses ketamine as a catalyst in our healing modality. And so the process is a process that can occur without the use of substances. But for those that we deem appropriate, we will use ketamine as a catalyst. And so with that, I'm really happy to pass the mic to Matt, who has years of experience using ketamine in this ketamine-assisted psychotherapy model. And before I do that, I just want to mention that, ketamine is an anesthetic. It's been used for decades, primarily as an anesthetic. And really, even going back decades, there's been some evidence of the potential of ketamine as an antidepressant. And that has become highlighted more and more. And now we have numerous studies showing the efficacy of ketamine as an antidepressant in the biomedical sense. And so what that means is that the chemical causes changes in the brain that actually result in this antidepressant effect. What we're doing now is using the ketamine in a psychedelic psychotherapy model. And so our goal is to create deeper change and longer lasting change with the combination of ketamine and its potent properties and skillful psychotherapy. So with that, Matt, I would love you to speak a little bit about ketamine and the work you've done.
Sure, sure. I mean, there are protocols with ketamine that don't involve psychotherapy, ketamine infusion for depression. And, that's one thing. We provide something different, which is ketamine-assisted psychotherapy. And I think we're really leveraging an opportunity that the ketamine opens up for us, right? It provides rapid acting antidepressant effect, also opens up a neuroplastic window, which I think often subjectively is felt as the ability to, in the patient, to think new thoughts, maybe have new behaviors. And I think where the psychotherapy comes in is that it comes in and it really looks to engineer ways to increase changes in the moment. I always say this about psychedelic work, which is that if it doesn't make us better at this here and now, then what's the point? So really, it's the psychotherapy piece is trying to kind of draw the through line from the large expanded state of consciousness to the present moment and see how it informs our ability to think and live differently in the present moment. So I feel like, in my view, having done psychotherapy with ketamine for quite a while now, I think that the psychotherapy piece of ketamine-assisted psychotherapy is really important. And if we were to not do it, it would be a huge missed opportunity. So, and I think people will often ask me, well, what does that mean, applying psychotherapy to the ketamine experience? It's like everything with psychedelic work, it's nonlinear and it's multi-layered and it's highly individual. The experiences are often different time to time, but different layers that I've observed and been trained to look for is oftentimes on kind of a core level, it deals with philosophical issues of what your life means. And I think you see this especially in palliative care, right? Where people are at the end of their lives, they're considering what it all means. I like to never forget that even as someone is facing the end of their life, they're still unfolding, they're still developing. In fact, they might be facing some of the most profound changes. I think mystic health, which is like facing what life means, larger senses of reality. Then another layer is sort of insights around just insights that can cascade through your entire life. Insights having to do with your own biography, sort of things that have happened to you in the past, memories, deep emotions. We'll see repressed emotions emerging, and these are all huge opportunities in psychotherapy, opportunities to sort of develop a relationship with those feelings. Perhaps there's wounds, and to begin to relate to them differently, to learn how to take care of them. So it's like so much is unlocked in ketamine experience, and then there's also working just on a very practical level of if someone is less depressed after a ketamine session, what are you going to use that as an opportunity to do differently in the next 2 weeks or week between sessions? Oftentimes I will give people homework, which is saying like, listen, this is the time to start exercising. It's the time to start meditating, so I try to look at it in a holistic sense, of the kind of the whole bio, psycho, social, spiritual sense, and I think when you engineer all of that around ketamine experience, it's when you see the potential for transformation. And there are certain clients for whom this is transformative work, and that's really satisfying, deeply gratifying as a therapist to see that. People who come in thinking that maybe, I had one client of mine say, I lost the genetic lottery. This is just the way it is. I'm never going to get better. And this person, through very deep ketamine work, has formally retracted that statement, said, you know what, actually, I'm a different person now. I have a different sense of who I can be. And, you can see it in this person's face. So that's, I have cases like that I remember and I really cherish, because this work can be, that's the word, I think, healing, but also transformative, like an unfolding of who you are at a very, very deep layer. And so that includes mental health symptoms, but it's not limited to it. It's sort of a bigger sphere.
Thanks, Matt. Yeah, you pointed out to so many interesting and important points. I'll try to address a few of them. I think one that you mentioned that I really like is this capacity to transform. And so, traditionally, we had this idea that you can't teach an old dog new tricks, and if we look at the newest research, especially done by Dr. Gould Dolan, who's at UC Berkeley now, she talks about these critical periods. And so the idea is that when we are born, when we are children, we have this immense capacity to learn. And that's why, at a young age, kids can learn a lot of things really quickly. And the newest research that she's done, this is done in the animal model on rats, but it shows that psychedelics reopen that critical period of learning, including ketamine. And so that actually does result in the ability to transform at any stage in life. Another important thing you mentioned is this notion of revelation of content that is coming from the subconscious. And, there is this debate. I feel like more and more people are classifying ketamine as a psychedelic. But earlier on, there was a lot of resistance to that. And, the word psychedelic derived from Greek, meaning mind manifesting. It means that something, that reveals content from your subconscious. And so, that's the work we're doing with ketamine. I think based on that definition, ketamine is clearly a psychedelic. And I'm sure that you've seen that in your work as well.
Sorry, I was muted. For sure. I think ketamine does different things at different doses. And, I've heard certain therapists and clinicians refer to it as a kind of Swiss Army knife, where you can, for psychedelic work, meaning that at different doses, it does different things. But there are certain dosage ranges in which it's very psychedelic. And so meaning that it kind of provides access to these, it amplifies, processes of consciousness, but it also provides access to the unconscious mind or the subconscious, whatever you want to call it. So these are, for those who've never experienced it, it's like, I think we can kind of talk around it, because these experiences are really ineffable, meaning hard to describe. But it can feel in some ways visionary. It can feel in other ways dreamlike. Other times there can be almost video-like replay of past events. I think there's something unique about ketamine in its being an anesthetic and being relatively short-acting, which is that it can provide a real sense of bodily safety, and that can be a unique opportunity for someone, for instance, who's been traumatized, where all of a sudden they're able to inhabit their body in a way that feels safe, maybe for the first time in decades. Now, the combination of bodily safety and then video-like replay of events provides an opportunity to process trauma. You know, when we say processing it, it means many things, but I think in general, people understand it as a going back to events, kind of moving back and in towards memories that weren't consolidated like normal memories. So that's, you know, it's one way that ketamine works. Again, this sort of Swiss Army knife idea during trauma treatment. And I think that, you know, one sort of individualized aspect of the treatment, you know, is again dosing. You know, what happens at different doses and finding the right dose for the right person and the right dose for the right clinical intention.
Yeah, exactly. And I think it's a really important point to note, you know, this range in effect with ketamine, and that's what makes it really amazing. You know, one of the terms that's used for lower dose ketamine is a psycholytic dose. And so that's a relational dose. That's the dose where you're, you know, relatively lucid with some of the defenses lowered, and you're able to engage in conversational type talk therapy. And then you move into the psychedelic range. And then if you actually overdose, and by overdose, I mean when you get out of that psychedelic range, you enter more the anesthetic type range. And part of the issue with that is that you end up not remembering your experience much. And so it becomes less useful in this context that we're using it. Yeah.
Right. One of my teachers, Ralph Metzner, at the CPTR program at California Institute of Integral Studies, he said that there was a dissociative threshold, you know, where at larger doses it becomes less personal. And so I think, you know, it's like finding the right size. You know, you want to catch the right sized fish when you're looking for these experiences. You know, you don't want it to be so big that you can't actually harvest it and pull it on board. You also don't want it to be too small where it's you know, not going to get you what you're looking for. So yeah, just to sort of reiterate what you're saying about dosing. Yeah.
Yeah, and then you pointed out to this, you know, this idea of trauma manifesting, of let's say a traumatic incident replaying, and I think that is one reason we do it the way we do it, which is providing support during the treatment process by doing the due diligence in advance of the treatment process, doing the preparation. You know, as we know, there's a preparation phase before a psychedelic experience and an integration phase that follows. And so, you know, depending on the background of the individual, that preparation work can be extremely important. Because if someone does have a significant history of trauma, we want to be aware of that. We want to work in advance so that when it comes up in such a therapeutic session, we can use that to our advantage and sort of create a healing process rather than a re-traumatizing process. And so the notion of post-traumatic growth can be applied here if the trauma is re-experienced but processed differently, such that, you know, the patient does better rather than worse. And I've heard many horror stories of patients getting treated in the biomedical model, where they essentially, it's very medical. You get the ketamine, you're usually in a very medical setting and left alone. And, you know, people are getting re-traumatized through that.
Yeah, that's one of my favorite expressions is post-traumatic growth. I feel like we're all trained to know about post-traumatic stress. It's very real. We've all, you know, as clinicians, we work with that every day. But there's also the notion of post-traumatic growth, which is that there's a potential to overcome yourself, transformation that can happen after traumas. And that's something that I think is a unique opportunity to psychedelic work. To say a little bit more about preparation, you know, I think I'm very relationally oriented as a therapist, meaning that, like, I think that, you know, there's something that one of my heroes, the psychoanalyst Nancy McWilliams, she said that psychotherapy is this something to talk about while deeper things happen. And I think what she's pointing at is the relationship. And again, to look at this in terms of trauma, there's often just a fundamental lack of trust among those who've been traumatized, whose trust has been betrayed. And so I think part of the preparation is, of course, psychoeducation about like what this could be like, why we're doing it, drilling down deeply into intentions. But then I think even more importantly, it's developing a relationship with the patient and establishing some trust. That trust in that relationship becomes, you know, part of the container for the psychedelic experience. So of course, the treatment room, vital part of the container. The music, vital part of the container. But I'd say the most important part is the quality of the relationship that you have with the client. And that has to do with safety, and it has to do with a type of sort of deep camaraderie that can help the client to have this bravery to go within these unknown places of themselves where the deepest forms of healing occur.
Yeah. Yeah. Thanks for bringing that up. I mean, therapeutic alliance is a term that's often used. The therapeutic alliance between the patient and the healthcare professional is probably the most important factor in the sort of outcome of this sort of treatment. And there are a number of research studies that do show that.
Yeah.
Yeah. Another important thing you mentioned is this emphasis on lifestyle change, on sort of behavioral activation, modification. And I think this is a really important part of this. You know, if we look at the reopening of critical periods viewpoint, you know, this neuroplastic state that we're in, that lasts between days and weeks after the ketamine treatment, is an opportunity to create permanent change in our lives. And, you know, especially for those that aren't closer to the end of life, it's this remarkable opportunity to foster this sort of change. And so it's really important that we emphasize that in our healing journey.
Yeah, for sure. I feel like it would be, I mean, I feel like I think psychedelic work without an emphasis on lifestyle change, like it can be for some people just getting high. And so I feel like I want to be very real with the people that I work with about like what you uncover in psychedelic work at its best points to things in your minute-to-minute lived experience that need to change. And so, I mean, I think that the rapid acting antidepressant effect of ketamine, in terms of raising mood, overall level of energy, often provides a kind of like raises the platform for people to stand on to make lifestyle changes. So I'm always thinking about it very practically in terms of like what needs to change here. Because there's the sort of the intrapsychic, the very deeply personal part of it, but there's also the sort of the directly measurable things that you do every day. You know, what's your relationship with alcohol like? What's your relationship to exercise, to your body, to food? Are you trapped in a relationship that is in some way dysfunctional that could use some therapy of its own or increased communication? So I feel like there's the expanded state that can often have a kind of a mystical flavor to it, but really want to work in practical terms to draw through lines from that state to this very moment that we're in right now.
Yeah. Yeah. Thanks for that. And another really interesting aspect is what we expose ourselves to, what goes into our stream of consciousness before the experience is also important. And so I have two very good colleagues in Montreal that are psychiatrists, and they've done some really interesting work with ketamine. And they've actually published this paper, and they've developed this model, which is like the Montreal model. And that's something that we'll talk about more and sort of implement in our practice. And it talks about a lot of what you've mentioned. But I know that one of their patients, for example, was addicted to video games. And so this individual was spending hours and hours a day playing video games. And so his ketamine experiences were very much based on those video games. And when they were able to change that, the quality of his experience also changed. So that's why in the preparation phase, I really like to sort of emphasize, what you feed into your stream of consciousness will play a role into your experience. And so we can try to optimize that in advance as well.
Yeah, I've seen something similar with people's relationship to work. In ketamine work that I've done, I had one client in particular I'm thinking about who wasn't making the progress that they hoped they would. And after a number of sessions revealed to me that they were working at a highly stressful job right up until the moment that they had to come for the ketamine session. And then, they were going home and continuing some kind of remote work from there. So what you're talking about is this, this expanded state, this opportunity for healing, sandwiched by 2 periods of very high intensity stress. And once I realized that that's the way this person was structuring their session, I had to say, like, listen, best practices here says that you need to stop doing that, if you want this to work, because there was something about that was getting in the way of the progress that could be made with this person's intentions in ketamine therapy. So this was really like, an extension of what you could call self-care, which is giving yourself some space on the front end and the back end of the experience. And then also, like what you're putting into your consciousness, are you putting a bunch of stressful work there, or is it time spent quietly writing in a journal, doing some yoga, stuff like that? So I think, I mean, to come to the mindfulness piece, it makes you examine sort of just the fundamental nature of your thoughts, what you think about, your inputs, what you put into your head. I mean, this is all really important. And I think in the day-to-day trance of life, we can forget that and just sort of think, maybe it's cool to play video games all day, but I think that the psychedelic experience oftentimes underscores that something there needs to change.
Yeah. Yeah, it's thanks for bringing up the mindfulness piece. I was about to pivot there. And I think it's important to emphasize because a lot of our model is based on mindfulness. And so there are different ways to define mindfulness. And, one definition I like to use is this sort of non-judgmental moment-to-moment awareness of what is. And the reality is that in our society today, we're usually either in the past or in the future. We're either, anxious or depressed. And, the ability to be here now and to fully embrace the totality of the moment is a blessing that most of us aren't able to attain. And part of the goal with our work, both in the preparation, during the session, and in the integration, is to work on mindfulness and to sort of implement mindfulness practices ideally into our life. And that tends to increase joy and allow us to live fully rather than being sort of in loops of thoughts.
Yeah, and I think this is something we see people struggling with now in our social media, tech-mediated experience, right? Is that, a client of mine who was really struggling with, we'll just call it phone addiction. They said to me in the depths of one of their ketamine experiences, they just heard these words in their mind. Their relationship to their phone was destroying, their ability to pay attention to things, right? The continuity of their thought. And they asked the question, kind of almost talking to the medicine the way that you can during psychedelic experiences. And they said, well, what's the opposite of that? And the word just came through in their head in block capitals: meditation, mindfulness. And so this was the beginning of their relationship to meditation, mindfulness practices, and something which on its own was transformative. But this is what I love about psychedelic work, is that oftentimes the person is discovering these sort of deeply wise things within themselves. So it's not me there as a teacher being like, you should do this, you should do that. You know, this person discovered this. I mean, they asked themselves this question and they came up with this answer. And then they felt the answer in a fully embodied kind of way. And, you know, they had been confronted by sort of a fact of their own psyche. And when they came back from it, they had to reckon with that. And ultimately that they came to the conclusion that meditation needed to be a part of their life every day. And so that's another lifestyle piece. But it was one that just on its own was transformative. You know, changed this person, changed their relationship to their phone, changed their ability to be present with others, present with loved ones. So it sent a cascade of positive effects through their life.
Yeah. No, it's really interesting. The sort of link between mindfulness and psychedelics is very strong. And Matt, you and I share the same alma mater. During my time at UC Berkeley, I took the David Presti course. I don't know if you took that, but it was a course talking about like sort of drugs and the brain. And I remember some fresh research, and this is over 20 years ago, showing how the neurochemical processes in the brain in Buddhist monks with, let's say, 30 years of experience meditating and LSD users were similar. And so this is something that we've seen over time. And, you know, for me personally, mindfulness has been a huge tool in my personal healing journey. And the most profound was when I did the Vipassana retreat, which is the 10-day silent guided Buddhist retreat. And it's remarkable how in that naturally induced altered state, we have very similar processes unfolding.
Mm-hmm. Yeah, I think I first encountered that those ideas about the similarities between the sort of the changes in the brain caused by LSD and meditation. I think it was in the book Zen and the Brain, which I got as a teenager. I was always very interested in psychedelics. As a teenager, I kind of knew that there was something different happening there. There was a different opportunity. And I was very lucky to be exposed to the ideas of thinkers like Terence McKenna, Alan Watts. These were really, really important ways to understand that this is a different experience with different opportunities than other drugs that people might use recreationally. So I didn't take any of Presti's classes at UC Berkeley, but he came and taught at the CPTR, the psychedelic program at CIS. So I did study with him a little bit, which having someone like him is really useful to me because my background is like a humanities person, musician, now a therapist, clinician. So it's good to have someone like that who can really translate these very abstract ideas about the brain into layman's terms. So yeah, I really highly recommend his work. And it confirms something that I think people feel about these experiences, something that people can feel at the core of their being, that done correctly, there's something really good. There's a huge opportunity here for evolution. Yeah.
Yeah. No, it's really interesting. So for those that don't know, David Presti is a professor at UC Berkeley. He's the co-founder of the Psychedelic Center at UC Berkeley with Michael Pollan. And he was actually close friends with Alex Sasha Shulgin. And so Sasha Shulgin, as we know, the late Sasha Shulgin was a key figure in the psychedelic movement. He synthesized many, many compounds, and he was actually the person who re-synthesized MDMA. So MDMA was actually created by the pharmaceutical industry and then parked. And Sasha Shulgin recreated it, tried it, and through that, it went into the therapist community, and it was used as an aid in psychotherapy, really similar to how this MDMA-assisted psychotherapy takes place. And unfortunately, in the 80s, it became illegal, and that's what inspired Rick Doblin to start the nonprofit MAPS to bring it to FDA approval, which almost took place, but was recently denied. And then there was a request for another phase 3 clinical trial, which will hopefully take place and continue to show positive results while addressing some of the concerns that were brought up regarding the phase 3 studies, which I was a part of. Montreal had one of the treating sites for that phase 3 clinical trial. I think another important topic to bring up on that note is the sort of the ethical piece when dealing with psychedelic therapy, when dealing with altered states. And so, I like to talk about the power differential that exists in healthcare in general. So, generally speaking, a patient is in a vulnerable position in the healthcare institution. My view is that when you're dealing with mental health, that sort of dynamic is amplified. So an individual with a mental illness is in a more vulnerable position than the average patient. And, if we look at psychedelics as non-specific amplifiers, you can imagine how that vulnerability can be amplified. And so, the reality is that a lot of ethical breaches have taken place during clinical trials and during psychedelic work. And so for us, especially at Mystic Health, we really emphasize the ethical piece. And, we try to do our best to promote patient safety and to have like a balanced dynamic of power between the care provider and the patient.
Yeah, I think that the vulnerability is critical, and I think it's really the ethical structures that you build around it that help to ensure good outcomes. I think that there's a vulnerability in good psychotherapy that's a necessary condition of healing. To maybe remove armor that you've had for a long time. But of course, you're right. There has been historically abuses of that. So I think that the first line of defense against that is acknowledging that this has happened, and also talking about it, and creating a culture of discussing boundaries and also sort of self-examination. So yeah, but I think just like in good psychotherapy, vulnerability is a requirement of healing. It's almost like having a surgery performed, like you make yourself vulnerable. But at the same time, that doesn't, I think that making yourself vulnerable, that is not inherently a bad thing. It depends on how it's handled, how thoughtful someone is, how well trained they are, what their intention is for your healing. And so I think, in general, I tend to do anything around this, I tend to do collaboratively with a lot of psychoeducation, with a lot of discussions around consent, informed consent, and these are part of that sort of relational container for doing deep psychedelic work.
Yeah. Thanks for bringing that up. I mean, the vulnerability is key. I think, going back to that therapeutic alliance, our patients need to trust us to be able to sort of be open, to let go. And really, that's how, what needs to happen will happen. It's, one of the concepts that we haven't really talked about yet is this notion of inner healing intelligence. There are different terms that describe this process. And so, if we think about it, let's say as the healing force that exists in our body, for example, our immune system that fights illness. For example, if we have a cut in our skin, this laceration, the body moves to repair it. And so the idea is that we have a similar process in our psyche. And, in order to allow for this process to take place, there is a degree of vulnerability, of surrender, to allow this sort of deeper process to take place. And thanks for bringing that up. And for sure, it's about, having the right training, having the right ethical framework for the healthcare provider to ensure that there is no breach that takes place. And it is definitely part of the healing process to surrender to that experience and to be vulnerable. And another thing you brought up is the surgery example. And I love that example. One of the things we haven't talked about is how this frame of psychedelic assisted therapy that we use is informed by indigenous wisdom. And indigenous wisdom is something that is beautiful. It's complex, something that's existed for millennia, something that, in my view, every culture has roots in. And so there is this beautiful indigenous elder by the name of Duncan Grady. And at Therasil, which is a nonprofit I work with in Canada, he does the indigenous piece of training for our trainees who want to be psychedelic assisted therapists. And so what he says is that in this sort of psychedelic process, if we were to look at it as surgery, we are not the surgeon, we are the blade. And this is just like, the first time I heard this, I was like, wow, this is just so beautiful. And the idea is that there is this greater process at work, and we are assisting. And if we are dirty, we're going to infect people, as we go from one person to another. And that's how surgery used to be. You would go and do surgery without sterilization and infect all kinds of people, and they didn't know why. And actually, the person who brought up this issue was sort of demonized. But it's our job as the providers of this care to work on ourselves and keep ourselves sort of sterilized, so as to not infect others.
Yeah, I mean, talk about what a great metaphor, and a great metaphor for being guided by something larger. And I think that larger thing is the client's inner healing intelligence. Some people that I think we both have studied with, the Mithoffers, Michael and Annie Mithofer, who did some of the earlier MDMA research. They talked about they kind of give you these little sayings and things that they've developed in their work. One thing they taught us, which is something that we resource the clients with, is it's a way to get out of their own way and allow the inner healing intelligence to kind of flow into them, or to unblock it, is to in the middle of the experience, if you're ever wondering what to do, it's to trust, let go, and be open. So they said, just remember TLO, trust, let go, be open. Because it's kind of, I've definitely worked with some people who have more of a type A organization, and they're like, we're going to get in there and we're going to think about these things. We're going to go through a list. We're going to do the work. And in cases like that, I've had to teach people to do less, and to also do this thing that for some people is tricky, which is, this is not something you do with your conscious mind. And so it's more sort of falling back into this trusting, this letting go, and being open. That is the sort of the condition, through which the inner healing intelligence can act upon us.
Yeah, that's beautiful. And that sort of brings in this concept that I've been working on, this concept of mystic health. And one way to look at it is, if we have a spectrum where one end of the spectrum is our ego. The ego is these set of constructs that defines our separation from everything else. And on the other end of the spectrum, you have oneness with all being. And that is that mystical experience that people have on psychedelics, and sometimes spontaneously. And we want to be somewhere on that spectrum that is healthy, depending on our goals, where we are in life. And so that is the balance we aim to seek. And if someone is full ego, full thought, then we want to tone that down a little bit and allow for something congruent to drive that process?
Yeah, I'm prepared to hold these experiences in a variety of ways, right? Like, and I think that the way I would describe that is being client-centered. You know, I've had people come to me from all kinds of backgrounds, all kinds of belief structures, and wanting to do this work. And, you know, I think oftentimes it gets quite mystical in terms of this sort of dissolving into something bigger than yourself. These larger senses of identification. Now, what people want to do with that when they come back from those experiences is deeply personal. For some people, it's frankly spiritual experience. And I think that having spiritual language to discuss it can actually be sort of an even deeper focus of healing that you can bring to it. But then again, some other people want to think of it more neurologically or psychologically. I'm prepared to work with it on any level. But I do think that the spiritual is just sort of a predictable feature of psychedelic work. And so being ready to sort of swim in those waters, discuss it on those terms, is something which I think is it's important.
Yeah. Thanks. Yeah, this notion of being patient-centered is definitely one of my core principles in the care I provide. And you know, and what you said sort of makes me think about this connection between the mind and the heart. And one of the themes that we see commonly in these psychedelic states is this the love being sort of the unifying force of the universe, of our experience, of our existence. And I believe I mentioned it briefly. There's a new study that came out, and that looked at how it's the connection of the brain with the heart, the actual nervous system of the heart during these experiences that may be a predictor of whether you experience the mystical states or not. And I've really sort of come to appreciate the value of feeling that boundless sense of love towards everything and the benefits it may have in someone who's suffering.
Yeah, and this is one of the wonderful things about all the research that's happening, is that it's confirming things that human beings have always known to be true for thousands of years, right? The importance of the connection to the heart. You know, someone who's more cynical could kind of hand wave that away as sort of something sentimental or something that's kind of touchy-feely. I mean, it's being confirmed by science now. And that puts us in front of a question. It puts us in front of a very deep question about who we are and what our own growth looks like. So, I mean, this is very inspiring because I think these are things that we've felt to be true on a very deep level, you know, for our whole lives.
Yeah. I do want to be mindful of the time. I mean, I think, Matt, you and I can speak for days nonstop. We do have 8 minutes, so if there's someone who wants to ask a question, you know, we're happy to open up the floor. And if not, I would love to continue the discussion further. Kabir, is there anything that comes up for you?
Yeah, I mean, I feel like if you could shed some light on any experiences that you've had as clinicians where you've had a patient or patients that have not responded or went into the experience, you know, coming out disappointed or not fully understanding how to utilize the medicine. I think that would be interesting to touch on.
Yeah, I think you bring up a really good point that we haven't mentioned yet. And that is the notion of setting the right expectations. And I think, you know, one of the issues right now is that, and that's changing in the media now. You have a lot more negative articles coming out, but there was a period where you had all these positive articles coming out, and people who are often disappointed by conventional therapies are seeking something to help them. And so people come in thinking that by having this one experience, all my problems are going to be solved. And I think it's important to set the right expectations that what we're offering here is not just a silver bullet that's going to solve all the problems, but we're actually just going to show you what is the work that needs to be done. And it's not that we're going to show you, but that your own inner healing intelligence is going to show you what is the work that needs to be done. And we're going to help you do this work in the integration process. And so I think setting realistic expectations is one of the key learning points in my experience doing this work.
Yeah, and I would add also that it kind of depends on where you are in the process. I think sometimes a client might early on in treatment have one difficult experience and come to the conclusion, this isn't for me, or I did it wrong, or there's something, maybe I'm beyond help. This is not going to work. This is a sort of almost like a maxim in psychedelic training in the psychedelic world, and I share it with people, which is that difficult is not bad. Actually, difficult oftentimes is the greatest opportunity for change. And I think that's where, again, the integration, the psychotherapy piece is very important, which is to sort of unpack what the difficulty was. And that's often a very rich process, and it can sometimes take a while to kind of understand what the difficulty was in a given trip, and what can come out of it, that is really useful. I would also say that in some cases, the effects are accumulative. And so kind of drawing a conclusion after a few weeks or even a couple months, it's maybe a little premature. And it's about kind of a longer course of treatment where you get to see the sort of the gradual effects of being held in that neuroplastic window for a longer period of time. So I often say, like, if something feels like, when you're faced in front of these questions, sometimes you can kind of hang out for a little bit and wait for it to shift on its own. Now, of course, I never want someone to kind of go against a deeply held intuition, and if someone says, no, this is not the right thing for me, I'm not going to push them through anything. But oftentimes it is a matter of kind of like, I feel like you're in the middle of something, and it might take a little while for that process to begin to complete itself.
Yeah. Yeah, you brought up another important points, which is the one on bad trips. I get this question a lot. What if I have a bad trip? And so the way I like to look at bad trips is, challenging experiences that aren't handled well. And that's why with, people with the right sort of training, we can help navigate this challenging experience into a healing experience. And if it's not handled well, then it can become a bad trip, usually in the recreational setting or in a biomedical type offering. I know we're about to wrap up. Kabir?
There's one question that I actually just shared with you right now, Dr. Houman. If you don't mind going ahead and answering that one, and perhaps Matt, if you have any recommendations. It's basically, if there's any books that you can recommend for clinicians who are beginning to work with ketamine.
Yeah, I mean, I would say that doing a ketamine training is definitely something that's recommended for a clinician wanting to work with ketamine. There are ketamine trainings that work more on the didactic portion, and there are ones that actually include these experiential learning opportunities for those that qualify. And I think it's a good idea for us to add some of those resources on our website, actually. There are Bibles out there, some like the Ketamine Papers compiled by Phil Wolfson that has, various aspects covered. Matt, is there a book that jumps out to you as a psychotherapist?
I mean, I'd say Wolfson for sure. I think the sort of the basis for my orientation is Stan Groff, and there's parts of Groff's work that I really hold on to, other parts that I let go of, but there's something about it. I think it's a really, really good orientation. And so I think, his classic book, LSD Psychotherapy, I think as an orientation towards psychedelic work in general, I think it's it's an oldie but a goodie. It's like, I mean, it's just that there's so much in there, and that's a real foundational book for me.
Thanks. Yeah, and that reminds me, I was fortunate to have a Zoom training with Stan Groff during the Psychedelic Psychotherapy Forum, which is a conference that takes place in British Columbia. And the conference is actually happening again in a few weeks. So if anyone wants to venture to Vancouver, or I think they have virtual options available, you can look up the Psychedelic Psychotherapy Forum. And yeah, it was amazing to have a Zoom call with Stan Groff, something that I will definitely cherish. And great recommendation for his books. Thank you. Yeah, and with
Wonderful.
that,
Thank you.
yeah, that was really nice, Matt. I really enjoyed that conversation. That was really, really
Of
nice.
course. Yeah, it's been a pleasure being here and talking with both of you. Yeah.
I have a feeling that one of the upcoming webinars is going to be centered around music and psychedelic medicine in the upcoming weeks or months. So that should be fun. But thank you both very much. And I really enjoyed that conversation. And thank you everyone for taking out time and space on a Saturday to attend. We're going to be continuing to facilitate these webinars, and really appreciate all of your support. Hope you have a wonderful weekend. Thank you.
Thanks, everyone.
Thank you.
Take care.